Hello, everyone. I hope you're doing well and everything is fine with you. So we'll have the exam experience session with the Academy's recently successful candidates. All right. Now, please make sure that this session is to gain experience from candidates who sat the exam environment, how it feels, how to manage your stress, how these candidates prepared for the exam. All right. So if anyone has any question in this, please make sure that you post your question in the chat section so that they can answer as well as I can answer them. All right. Don't ask questions in regards to how to manage the case or what to do about this case. All right. That's not what the purpose of this session. The purpose of this session is to gain familiarity with the exam environment, the practical exam, how these candidates cleared the exam. All right. So that's what you should be learning in this particular session. All right. And apart from this, of course, we had a good month, which was December 2024, where we had 8 candidates who cleared the practical exam. 7 out of 8 candidates cleared their exam in the first attempt. All right. So you should be learning from them the strategies they implemented, how they worked their way towards achieving success in the practical exam. And that's what you should be asking the questions in regards to that. All right. All the ifs and buts in regards to the practical exam, the examiners, how the stations are, what materials are available, how did they cope up with the task, the time management, their preparation strategies, what they did, for how long did they prepare, and all these things. All right. So, yes, I believe we have a few of the past candidates with us today, because those candidates that passed the exam who are in UAE, who are in Saudi Arabia, who are in Pakistan, were not able to attend because, of course, it's their working time uh, right now. So they were not able to attend, but we tried to get the candidates who were able to attend so that you can gain valuable advice from them in regards to the preparation for the practical exam. All right. So let's get started. So we have Dr. Jinit with us. We have Dr. Jinit. Are you there?
Yes, Dr. Raza.
All right. You sound quite happy. And what
Yeah.
about Dr. Sandri? Are you here?
Yes, I'm here.
All right. That's good. I think Dr. Essen, Dr. Maham, Dr. Abigail, she was sick. She was not able to attend, but she might be here. But anyways, that's fine. That's all right. So we will start with whoever is available. And if they do join later, we can ask questions from them as well. All right. So who would like to start first? Dr. Janet or Dr. Sandria?
Um, uh,
You
Dr.
passed
Jin
the practical
can
exam and
start
you
first.
can't make a decision on who can start first.
uh,
All right. So,
uh,
Dr. Sandria, you can start. That's fine. We won't take much of your time, probably around 30 minutes, but that does not mean you have to speak for 30 minutes. Just share your experience in as little words as possible because we'll save time for the candidates' questions later on. All right.
Okay.
So please start regarding your practical exam. First of all, congratulations on clearing the exam. Of course, meant to be one of the most difficult exam for general dentistry across the world. Clearing it in the first attempt is not an easy task. Of course, everyone praises the mentors, the academy, but they don't see the hard work that the candidates put in. All right. So you should be proud of yourself. It's not easy. The journey is not easy. It's very stressful with all the financial concerns, with all the energy, the time, the commitment that has been spent, and you should be proud of yourself. All right.
Yes, thank you. And a lot of people think that it is your work only, but I disagree with that. It is always, it all boils down to the guidance that you had while you were preparing for the exam and also your luck.
Mhm.
That is what I can say.
All right. So, how did you prepare for the exam? How many months did you spend preparing for the exam? I know you quite well, of course. You have been with me for the written and the practical, but I want the other candidates to know who are preparing for the practical journey so that they can take advice from you.
So I prepared, um, I prepared for 6 months. I am working as a full-time dentist in Dubai.
Mhm.
So my circumstance might be different from others who are preparing right now. I also have a family with me, so it's very tough. For the first 3 months, I familiarized everything, and I was just practicing without any target. Okay. And then the remaining 3 months, that was where the actual preparation was. So the remaining 3 months, I was religiously practicing every day
Mhm.
before I start my work and after my work. And I always get a target, for example, in a day to practice, let's say, at least three technical stuff in a day. For example, I always make my schedule.
Mhm.
For this week, I will tackle the preparation only. And in these days, I will only perfect all those preparation tasks. And I will make sure that I will practice at least three preparation tasks in that day. So that is how I prepared for the remaining 3 months. For the communication, I always have a goal to at least practice 2 sets in a day. So, for example, I will get a set one and set two on Monday, and then Tuesday, three and four, and then so on. So, it doesn't mean that I have to perfect it, but I always make sure that I time myself whenever I do the practice, just to, be in that environment and have that pressure in you in the beginning while you are preparing.
All right, that's good. So you said that you prepared for 6 months. And
Yes,
how did you know that you were on the right track?
I
Because
never knew.
preparation, to tell you very frankly, now let's say that in the month of December, there would be have been around 50 candidates who sat the exam, right? Okay. Um, we had, I think, 16, out of which 8 and 9 passed. The remaining might have belonged to other
My
academies.
exam,
Don't see
sorry, my
much
exam was
candidates.
was November end.
November end, that's the same thing. Yeah, November end to December mid,
Ah,
I believe.
okay.
So out
Mm.
of those 50 candidates who sat that month, we had 9 candidates who cleared. Probably other academies had a few more. So roughly around 15 would be the number, right? So a lot of candidates do fail the exam, isn't it? So what was the thing that you did differently compared to them? Of course, there must be something different, right? Because not everyone clears this exam, especially not in the first attempt. So that's why I asked, what did you do to make yourself feel that you were on the right track?
To be honest, the only thing that I did differently, I think personally, I prayed so hard. I prayed so hard that the exam environment and my circumstances will be according to the exam environment. I always prayed for a clarity of mind on the day of the exam. And then, second of all, the last month of my preparation, I dedicated that for all the mock tests. Mock test, I mean that I simulate how I expect the exam environment will be on the day of the exam. So, for example, for my technical skills day, on those 4 weekends during my off, I go to the clinic and then I time myself at the exact same time where the exam will be. So, for example, I think it will be 6 hours, right, for the technical day.
Mhm.
So I also did that in all my 4 weekends. And the other day of my off, I also dedicated that for my communication, my communication OSCE and technical OSCE. So the duration of the exam and my mock test, I made sure that I also did that, considering all the aspects that comes into the examination day, like the pressure and everything. So I also did my breaks. I also did the exact same time, like how the exam should be on that day. That is
All
the
right.
last month
And what about the
of my
home
preparation.
setup? What advice would you give the candidates regarding the home setup?
I got my clinic set up because I am working and I want to save as much money as I can. But surprisingly, the this mannequin that I bought can
Mhm.
also be used for home.
Mhm.
This is what I realized on the remaining months of my preparation. So, for example, every day I'm doing my practice in the clinic. approaching my day off, I'll take my mannequin home and then I'll practice whatever task I can do without the
Mhm.
handpiece, without the everything. So I'll do my, for example, I'll do my technical OSCEs at home, my
Mhm.
amalgam restoration. Some of them I'll do it at home, and then the rest I'll do it in the clinic, like the preparation task, which requires handpieces.
Okay, all right. And did you have an OSCE partner? How did you practice the communication OSCEs?
The communication OSCEs, I followed what Dr. Omar has advised before from the experience session. He
Hmm.
told that whenever he practice, he will time himself for 10
Hmm.
minutes, and that is what I did. So, as I said earlier, every day my target is to do 2 sets in a day,
Hmm.
and I tackle all the cases from the portal. And every time, so if I say that my what is this, my target is to do 2 sets in a day, I don't mean that I memorize everything from the portal. Of course, I memorize the facts, which will not change regardless of which mentor you are going to. By
Hmm.
facts, I mean that, for example, for the extraction, post extraction care, I memorize all those facts, of course, but how you communicate, I did not memorize that. I memorized your pattern. Like you introduce yourself, this reassurance, everything, but I use my own words to do that, and within those 10 minutes. So for example, if I tackle one case and I feel like I didn't complete all the information that I wanted to give in that 10 minutes, I will restart again,
All right. So
and
Dr.
then I'll
Noor
change my
Suleiman, you're
flow. Yeah.
mentioning who was with me, right? The one who's in Abu Dhabi.
Yes.
Cleared the exam. Yeah. All right. Okay.
Yes.
And what about the technical task? Like when you used to do the technical tasks, of course, you were in Dubai, like you mentioned. So how did you know that you are doing the job according to what the ADC marking rubrics expects from you?
I just followed your advice. And of course, the rubrics that you always tell. If you remember, I always send you so many pictures, and I'm sure that I don't know how you manage your patients, but I'm sure you must be, irritated
Yeah,
sometimes
I've
from
lost a
all
lot
the
of
silly
hair because of
questions.
that, but that's how it is. You send me a lot
And
of work for
I
assessment, right? But that's a good
yeah.
thing. That's how you learn, right? If
And I
someone is
think
there to
I
tell
think
you your
one I
mistakes.
think one yeah, I think the best advice I can give to everyone who is appearing the exam, regardless of experience and specialty, is to humble yourselves. um, have the humility. I know a lot of people, especially from the clinic where I work,
Mhm.
that are specialists who are more experienced than me, and they couldn't clear the exam in third, fourth attempt. And I think it has to do with the character of a person. So if you are appearing for an exam and you feel like you already know everything, and you attack the guidelines that the ADC has, or you attack the mentors, or you question the mentor,
Mhm.
it will not do you any good. So first of all, have put this in your mind that you are here to learn, and your mentor knows better than you. So you should position yourself in that way. That okay, I need help. My mentor knows better than me. I should follow what the mentor says. This is, be humble and know that you don't know anything, or have a growth mindset. This is what I can say.
Well, that's true. Actually, we do face a lot of candidates like this, both in our written and practical courses, where they feel that they know anything, they know everything, but that's not what the ADC wants from them, right? ADC will only pass you if you satisfy their marking rubrics, the checklist that they have in place. All right, and having a humble approach that there is always room for improvement. That's how you turn the learning curve upwards. All right. So, from your point of view, like I know you attended our courses, you were with us in the written and the practical course, and now coming on to the day of the exam. So, how did you find the exam? Because, of course, it's a stressful environment. You are there, you are communicating with strangers, the examiners, they are not known to you. So, how did you cope with the stress on the day of the exam?
I always start my day with a prayer. That's the only thing you can do, no matter how prepared you are, or you think that you are intelligent or whatever. Without God's guidance, you will not be able to continue this. this exam for 2 days with a clear mind. So the only thing I asked was just give me a presence of mind, clarity of mind, and I should not, I should keep myself together on that day. And I thank God for that. That's number one. Second is that they always tell you to be friendly with everyone, but in my batch, it did not happen, and everyone was just so quiet. And I think that that is good, in my opinion, because if you are coming into a very high pressure environment and everyone will just talk about how many is this your first exam or whatever, it will give more pressure to you. So it's better you'll be on your own on that day, and then clear your mind from all negativity.
All right, that's fine. Thank you. Now, one last piece of advice from you is that a lot of candidates think that this exam cannot be done in the first attempt, right? So, like I mentioned earlier, we had around 7 or maybe 8 candidates who cleared in the first attempt in the last 2 months, and you were one of them. So, what would you say to candidates who believe that it can't be done in the first attempt?
It can be done. I wouldn't say that it's easy. You need to really put the work. Of course, you have to be confident because the examiners will really gauge you if you're ready to enter the Australian workforce. And you have to be confident in the sense that you don't need to act confident. Rather, confidence is an inner work, and it will show in your composure, in the way you communicate, for example, and the way your body language and all. So um you really need to put up the work. You If you really want it, you need to put a lot of work into it if you really want to clear it in the first attempt.
Okay, all right, that's fine. Thank you so much, Dr. Sandria. Wish you all the best. Now, you did ask me the message regarding the options for you. Now, the first thing that you need to do is regards to your English exam, right? So you have to get the PTE done. Okay, are you planning for the PTE or the IELTS?
Yes, PT, I think it is much faster.
Much faster, much easier. All right. So once you get the PTE done, you will apply for the APRA, right? In accordance to the other documents that they want from you. All right. The APRA application is
Mm,
on the website. You can download the
mm.
application. Most of the documents you must have already have with you. Since you have practiced in Dubai, you can just get the good standing certificate from them. Have you practiced anywhere else in the last 10 years?
No, only here.
Okay, so then it means that you just need that. In Dubai, you will get the good standing certificate in minutes. All right. And then you
Mm,
get the English test done. Once the English test is done, you start submitting your documents to APRA for registration, which will take around 4 to 6 weeks. All right. But in the meantime, you have two options in order to start working in Australia. One is that you apply for the state sponsored visa, which is 491. All right. You go to the website and you lodge an expression of interest in the state that you would like to move to. All right. They do take time for the expression of interest. It's not a very fast process. It takes time, all right, but depends on the vacancies and the slots available with the Department of Home Affairs. You might get an expression of interest, and they will say that you can proceed with your application to move to a particular state, all right? So expression of interest is separate for each state that you would like to move to, okay? Now, this is one
mm,
option. The second option you have is to go through a work visa, which is 482, which is also now called as skills in demand visa. All right. For that, what you need to do is you find an employer in Australia who is willing to sponsor you. All right. And if they are willing to sponsor you, you go through a skills in demand visa, which is much faster, much quicker, and probably in 3 to 4 months, you might see yourself landed in Australia. Okay. But the thing over here is that for the employer sponsored visa, you have to work for that employer for the next at least 24 months, 2 to 3 years.
mm,
All right. But the thing about this employer state sponsored visa is that you don't need to work in a particular state. You can find an employer in any state that you would like to if they are willing to sponsor you. That can be Victoria, that can be Western Australia, Queensland, any state you can find an employer. And if they're willing to sponsor you, you can move and start working in that particular state. The state nomination visa that I mentioned earlier, unfortunately, they are not open for all states, all right, in Australia. There are certain restrictions on that, means that you have to work in a rural area. So in Australia, what is considered as a rural area? Any city except Melbourne, Brisbane, and Sydney is considered as a rural area. All right. Which means Perth and all the other great cities belong to areas where you can work on the state sponsored visa, which is 491. Understood?
Yeah, but I was speaking to Kanika, I think last week. She told me that they removed the restrictions recently for this skilled what
Yes,
is
that's what
this?
I said. For if you
494?
the skills, which means the employer-sponsored visa, there are no restrictions. You can move to any state, any city you want, as long as the employer is willing to
Mm,
sponsor you. For the state-sponsored, the
mm,
restrictions are still there, and you can't work in the three
okay.
cities that I mentioned, which is Melbourne, Sydney, and Brisbane. For the employer-sponsored, which is
Mm,
482, skills in demand, and 494, you can work in any city,
mm,
any part of Australia, as long as the employer is willing to sponsor you. All right. Now, compared to the
mm,
processing times, the 491 is a very lengthy processing time. It might take around a year or more. Okay. The state
mm,
sponsored, which is 491. The 494 and 482, which is the skills in demand, like I said, you might find yourself landed in Australia within 3 to 4 months if all the documents are ready and you have submitted. Okay.
mm,
Now,
okay.
in your case,
Yeah.
one more advice I would give you, because we had Academy had these practical candidates, Umar and Taha and
Mm,
Sam Durrani,
mm,
these three candidates we had recently who cleared with us, who were part of our courses. I think they have already done the visa process and everything. Maybe you can stay in contact with them to see what options they opted for, how did they go through it, and maybe they can give you more accurate guidance at this point of time, because they
mm,
recently did all this a couple of months
yes.
back. All right. Any other
Mm,
question you have?
okay. No, I think I'll just message you personally in case in the
That's
future.
fine. If you have any questions in
Yeah.
regards to the APRA registration, visa, and even the employer, if you want, we have a lot of people that I know who are willing to sponsor overseas dentists. So if you are having a hard time finding a sponsor, which I believe you would not, because there are a lot of dentists willing to sponsor. So if you do have a hard time searching that, you can just let me know as well. I know a lot of dentists who are willing to sponsor. All right.
Okay. Yeah. Thank you.
Thank you. All right. Coming to Dr. Janet, are you with us?
Yes, Dr. Raza.
First of all, congratulations on clearing the
Thank you
exam.
so much.
And
Thank you so much, Dr. Raza.
I can see from your messages that you sent you were quite happy. And of course, you
Yes,
should be happy. It's not only achievement for you, for your family, and a big burden is off your shoulders. Uh,
yes,
Achieving
absolutely.
success in this exam is not easy. Like I mentioned earlier, it's one of the difficult exams for general
Yeah.
dentistry all across the globe. Clearing it in the first attempt is not easy, because once you clear, you have a lot of stress that is gone, and now you can focus on what you really love to do. All right. So
Yeah.
I'll come to the questions. Like I asked Dr. Sandri as well, how
Okay.
did you prepare for the exam?
I cleared my part one in April, this March, April.
Mm-hmm.
So as soon as I cleared, I started collecting home setup.
Mm-hmm.
So entire month of May went in collecting home setup. So by June, I was ready with my home setup.
Mm-hmm.
And once the home setup was here, I started with technical tasks, but I took it really slow because I was not sure how to go about with it.
Mm-hmm.
So to start with. And by August, I think I was done with the OSCEs. So by September, I started revising again. And this continued till September, October mid, where I completed all the technical tasks as well.
Mm-hmm.
Then from October mid, I made sure I do at least 3 tasks a day when it's Thursdays and Fridays. And from November, I started doing mocks, like it was mentioned in the previous practical session who passed. They had
Mm-hmm.
mentioned that they do a lot of mocks. So from October end, I started doing a lot of mocks, and I even went to OTC for 1 week just for for the skilled OSCEs,
Mm-hmm.
because I didn't have anything in Perth here.
Mm-hmm.
And yeah, so basically that's what I did. So the last October and November, December, I was completely focused. I stopped work,
Mm-hmm.
and I was only doing this. So in a week, I used to make sure I do it twice. I used to complete all tasks twice.
Mm-hmm.
And the last 2 weeks, I had kept a timer, like Sandria mentioned.
Mm-hmm.
I also kept a timer, and I used to time myself and see if I'm completing within time. So that's how I prepared. I didn't have an OSCE partner. So I used to actually do it in front of the mirror.
Mm-hmm.
And once I got bored of that, I got hold of my husband. So I used to practice with him. He's not into dentistry. So with him, it was easier because he used to ask me a lot of questions. So then I used to sit and explain him. Then I understood, okay, so that was working, but I was not very confident till I practiced with you. When I practiced with you, I understood, okay, seems like I'm on the right track, because all were practicing with dentists and I didn't have anyone to practice. So I felt that was a drawback for me, but it all worked out at the end. So
Okay.
yeah, that's how I practiced.
All right. So, in regards to the technical task, like you said that you were practicing, so how did you know that you were following the criteria?
So after doing each and every task, I used to send you photographs, and
Mm-hmm.
there was like, even if it was not good, I know it's not good, but I used to send you just to make sure that maybe what else can I improve in that. So I kept doing, kept seeing the videos again and again. The first time I did task, I actually looked at each step you did and I did it accordingly, and that's when I actually got something which looks similar to what you did, and it was somehow satisfying the criteria. It took me a lot of time to reach at least satisfactory. I
Mm-hmm.
remember it was only in October that you said, yeah, now this seems okay. So before that, it was not reaching up to the mark. But by October, when you said that, yeah, it seems okay, that's when I got a little confident. Before that, I was not sure I could do this.
All right. Now, the other thing is that in regards to the communication, like you said, you didn't really have anyone who was going through the practical exam, and you practiced with your husband, and with me, you had a lot of sessions as well. So, what would
Mhm.
you say to those candidates who don't have an OSCE partner?
I would say that instead of, if you're looking for an OSCE partner, you don't really need to look for a dentist or someone in the same field, because they are used to listening to this. So you will be, even if you explain in some dental terms, they don't really catch it. But if you explain a common man in a dental term, they actually come back to you and ask, what does that mean? So that's what happened with my husband. So he used to tell me, what exactly is that? Then I used to be like, okay, this is not the way it is supposed to be. So I think if you have anyone, practice with anyone, whoever you get, even if it's a family member, it works
Mhm.
out. Uh,
Okay. But
so
the
yeah.
thing is that if you are not practicing with a dentist, let's say, then you
Mm.
practice with your husband. So what feedback did he give you? Probably because he was scared of you, he must have said that you are doing good.
No, no. He actually told me that this you so he used to ask me so many questions that the time used to get over. I couldn't complete the case because of that. So but apart from that, after doing it with him, I used to realize if I could understand if I'm doing it well, or if
Mhm.
I know what the treatment should be, because in some cases I used to get confused while explaining what should happen next. So even though he understood from here and there little, but I could assess myself a little, I felt.
Okay. All right. That's good. So you have been with us for the written exam, you have been with us for the practical exam, and you have cleared the
Yes.
exam, which is an amazing feeling. So what would you say regarding the exam itself, the day of the exam?
So this is actually what you told me to do. I will say the same thing. That once you leave a room, for OSCEs especially, no matter what happens in that room, leave it there itself. So I think I got rubber dam and I completed the task, but I couldn't remove my gloves. But
Mhm.
I got really stressed thinking, oh no, I didn't remove my gloves. Now what will happen next? But then I just kept it there itself and I went out. And I cleared rubber dams. Surprisingly, I didn't know I would clear, but usually if something like that happens, you get so depressed that in the next room you end up messing things. So that is one thing I would say. Also, on the second day, I met a lot of people who are well experienced dentists. I'm a fresher actually. So looking at all of them, I was really discouraged. I thought, oh my God, so many well experienced dentists are here. What are my chances? That was my thought. But somehow I calmed myself a lot, and I only looked at myself. And that's just focus on what you do. And also, like Dr. Sandria said, only pray, because I think prayers work. It's a miracle that I passed, is what I feel.
Okay, all right. Now, of course, the exam, like I mentioned earlier as well, that it has nothing to do how experienced you are. If you're a specialist, you're a general dentist, you're a fresher, or you have a lot of experience. It's all about satisfying the ADC marking rubrics and satisfying the ADC examiners, all right? Maybe you are a specialist, maybe you have two specialties, but if you don't satisfy the examiners and the rubrics, there are no chance you might sit the exam for 10 times and you'll still continue failing. That's the most important thing, all right? And looking at the exam, you might see there might be seniors, there might be your juniors on the exam day, or while you're practicing in the courses that you attend, you might find someone is a senior to you, someone is a junior to you. That all does not make a difference, all right? This is not a BDS degree exam, it's a licensing exam, and these exams are specific to the criteria on how they feel whether we should pass this candidate, whether he's ready to enter the Australian dental workforce or not. Okay. Now, what final advice would you give, like I mentioned earlier to Dr. Sandri as well, that so many candidates sit the exam, many sit the exam multiple times. You guys cleared the exam in the first attempt, along with the others we had. So, what final piece of advice would you give in regards to the preparation, in regards to the courses to attend, in regards to the time that they dedicate towards the preparation and the exam day itself?
I would say course, you don't have to go anywhere. Whatever you need for the exam is there with Dr. Raza, because I had gone for this 1 week course, and there for skilled OSCEs, many people said many different things, which was not what Dr. Raza was saying. But I didn't listen to anyone. I just followed what Dr. Raza's, what is there in Dr. Raza's portal blindly, and that is what helped me clear. Apart from that, I would say dedicate as much as time as you can in technicals, and always do it with a timer, because at home, even if you complete it within that particular time, in exam when the setup is different, you somehow end up completing everything on time. Like I used to complete the task in 4.5, 5 hours, but on the exam day it took me 6 hours to complete. So and rest, work as hard as you can and leave the rest to God. So, and be calm on your exam day. That's really, really important, because yeah, in one of the sessions, one girl got so stressed that she fainted, and then she couldn't do anything after that. And she was pretty confident she would clear. So it was the stress that did that to her, is what I feel. So be as calm as you can, and don't look at anyone. Just be focused on what you are doing and what you have to do. That's it.
All right, thank you for that. And what are your plans now?
So I'm already in Perth, so I'm actually applying for my APRA registration.
Mm-hmm.
And I got into UWA as a lecturer in Endo recently.
Mm-hmm.
So I just started there. Now I'm trying to complete my registration, and once that's done, yeah, I've applied for PT, so that's next month.
Mm-hmm.
So once that's done, I'm planning to join some clinic and start from there.
So you have worked as a dental assistant in Perth before?
Yes. Yes, as a assistant.
So you must know a lot of employers, right? Then it will be easy for you.
Yes.
Yeah, so all you need to do is just give the PT and get the registration done, and then
Yes.
it's a straight path for you. All right.
Yeah.
Wish you all the best, and
Thank you so much, Dr. Raza.
I hope you have a beautiful career, and hope you get satisfied with practicing dentistry. All right.
Thank you. Thank you so
We'll
much.
just go through the chat section to see if there is any relevant question. So we have here is congratulations to your academy and all the candidates. How much you were confident to clear the exam after it ended and before you started the exam. So how much you were confident to clear the exam after it ended. Dr. Janet and Dr. Sandria, do
Uh,
you know how much you were confident?
no, I was 50-50, like anything can happen. Because I knew my amalgam was not good. And then once you finish the exam and you go back, you sit and think and you realize you made a lot of mistakes. So then it's like no idea. So it's always 50-50, and I was actually not expecting to pass.
Okay, I'll add to this now. The confidence that you have in the exam depends on a lot of factor. The first factor, which accounts for almost 80%, is your preparation level. If you're not prepared enough, you will never be confident in clearing the exam unless you're a super lucky person. All right? Because your preparation makes you confident. The more time you spend, let's say, on technicals, going through all the cases, the communication cases, the technical OSCEs, so the more time you spend on them, the more confidence you gain. All right. So this is the most important thing. Confidence depends on your preparation, whether it's the written or the practical. The other part, 20%, depends on how well you control your stress, because everything on the day of the exam will not go how you have planned it. Please remember that, because there might be untoward incidents, circumstances where you felt you could have done better, especially communication OSCEs. You might go walk out of the room and you feel that I could have done better, I could have said this and that. So the remaining 20% depends on how well you cope with stress and how well you do on the actual day of the exam. Because I have seen candidates who are prepared very, very well, but they are not able to deliver that preparation level on the day of the exam where it actually matters. Because for the technical day, you have 6 hours to prove yourself. On the clinical skills day, where you have the communication OSCEs and the technical OSCEs, you roughly have around 3.5 hours to prove yourself. So everything you do in this particular time depends on the results depends on this. No matter how well you were prepared beforehand, it does not really make much of a difference. A candidate who's well prepared but not sufficiently well prepared might do actually well on the day of the exam. So it all depends on how you do it. We had a recent candidate, I won't take the name, but we had a recent candidate who failed the entire exam because he failed the restoration cluster. And I asked him what was wrong. He said that I got amalgam 1.7. So I said, what was wrong with 1.7? He said, I never did that in my preparation at home. I always just focused on the lower amalgam, which was 3.646. Now, you see, if you have never done something before the exam, you cannot expect to pass that task on the day of the exam, especially with tasks with greater complexity like amalgam. All right. Maybe crown preparation here and there you would manage if you get a new tooth. But if a task which you have never done at your home setup, especially the upper amalgams, because amalgam is considered one of the most difficult tasks to master in this technical day. So if you have never practiced that task at home, you can't expect to pass or do that task well on the day of the exam. And that same thing happened with that candidate. He failed the entire exam for that one task. He failed the restoration cluster. Now we have to sit the exam again. So I told him, because you have spent so much money, you have spent so much energy, commitment, doing everything well. He passed all the remaining 15 tasks. He failed one amalgam and he failed the restoration cluster and he failed the entire exam. So I said, why did you not do? He said, I never felt like doing it because I believe it would not come in the exam. So you can't predict the task that would come in the exam, but you need to make sure to prepare yourself well according to what has already been asked in the previous exams. All right. Doctor, what do you suggest writing in the 3 minutes during the OSCE, like info given in question or points to need to be said? What do you suggest helps? Now, again, it depends. Okay, Dr. Janet, you can answer this first.
Uh, so I only wrote, so when I looked at a case, I only mentioned and wrote something which I thought I could forget. Apart from that, I didn't really write anything.
Okay. Again, it depends. It's not the same for everyone. I have seen candidates who have passed the exam who have never written anything on the paper. Some candidates note down the bold points like important questions, steps of management. So it all depends on you. It's not going to be the same, and it can't be the same because you'll be running from station to station and from task to task. So you can't make sure that you write the same thing in every station. So you will know from your practice what is the thing, what is in the case delivery that you are forgetting repeatedly, so that you note that down on the paper and you don't forget that on the day of the exam. All right. Regarding the dental loops, I want to ask when you wear them and how to wear them with prescription glasses. Dr. Janet, would you answer that?
I don't have prescription glasses, so I'm
Okay.
not sure. But yeah.
Now, with regards
I
to
am
the,
wearing contact lens. Sorry.
yeah,
Sorry, I
yes,
want to answer that question.
yeah.
I wore a contact lens over my loops. So that makes a lot of difference and it is much easier. So I would suggest like maybe go to an optical shop and purchase the same power that you have with your glasses and then use that on the day of your exam. Maybe a week before so that you'll get that adjustment done from your eyes.
Yes, this is one way and the easy way to make yourself comfortable on the day of the exam. The other way is that if you want, you can attach the loops to your prescription glasses itself. Like you can modify your prescription glasses and attach the loops to it. All right. Because you cannot wear the prescription glasses, and on the top of that, you cannot wear the dental loops. Okay. So either you can modify your prescription glasses to include the loop components in it itself, or as Dr. Sandria said, you can use contact lenses. All right. How you manage infection control on both days. Now, this is a very broad question. All right. And the details regarding how to manage the infection control, what things you need to take care in each task. There is a complete file and a video in the infection control folder of the portal. Make sure, Dr. Surbi, you watch it. All right. And if you have any specific question, you can ask me. How long did you practice OSCE for? They have already mentioned that they have practiced for the last 5 to 6 months. How did you go with infection control during the practice exam? Did stress affect that? So, Dr. Janet, will you answer that?
So no, so you have to be like really present there, and you should have that presence of mind to make sure you don't drop anything or you don't touch anywhere. So I was really conscious and I was really careful about that. So if you calm yourself, that can be managed very easily. But
And
I would say make
yeah,
sure you practice it at home as well. Because
exactly.
I last 2 months I practiced a lot at home and I was very particular to not touch the
Yeah.
chair and everything, and that helped me.
This was something that I wanted to add, that when you do the task at home, especially candidates who are closer to their exam, in the last 1 to 2 months, try to practice the task in the same way that you plan to do it on the day of the exam, which means wearing the complete PPE, the mask, the gloves, the eyewear. So practice doing this. All right. Because it will make it easier for you to do the same thing on the day of the exam. If you don't follow it according to what you have to do it on the day of the exam, you will panic. And when you panic, you get stressed. And when you get stressed, you will make mistakes, which you could have easily avoided. All right. My exam is in February. What is your last minute prep advice? So, can you give them last minute prep advice?
You can utilize the remaining days by doing a mock test. So, as Dr. Raza mentioned, when you do a mock test, you have to make sure that the environment is the same as how you expect the exam environment will be, following all the protocols. So, for example, if you are doing the technicals, then make sure that you follow the steps, wearing the disposable gown, the mask, everything, hand washing. You do it the same time as what you are expecting to do on the exam day. Because if you are going to deliver only on the day of the exam, you will not get the rhythm of, for example, the hand washing. Because when I got my technical OSCEs, these examiners will really check exactly how many strokes you did with your hand washing. If you clean the thumb, if you clean the tip of your fingers, if you scrub properly. They are literally like 2 inches beside me. So if you don't get that right, or if you don't get that flow already with you before the exam day, you will have that stress when you deliver on your exam day. So make sure you do that in these remaining days.
Thank you for that, Dr. Janet. Any advice?
I would say the same thing, to practice as much as you can and do mocks. And yeah, that's it.
All right. The examiners are rude or are they nice? We have a
So
question here from Dr. Fiza. Yes, please answer
Do
that.
you want to go first, Dr. Jeanette?
no, you can go.
The examiners are not nice and they are not rude at the same time. They are paid to, give you that experience, and you should not be thinking in that way. Like, you should be prepared no matter how they behave, you should be able to handle that, because they are simulating the same way that how you will meet a patient who is behaving in that kind of situation. For example, in one of my cases in my communication OSCE, I got a lot of, you know, resistance from from one of the examiners. And
Mhm.
the way I cope with that is I was only thinking that, okay, how am I going to respond to this in the real scenario when my patient behaves in this way? So I just responded like, you just need to be yourself. Don't memorize any scripts, and just, you know, um, put yourself in that situation. Imagine, close your eyes and imagine that you are in the clinic and this person in front of you is your actual patient.
Yeah, behave like a dentist, basically, right?
Yes, yes.
Okay, Dr. Janet, can you add to this?
Yes, it was the same for me. All my examiners for OSCE were very nice, except one case where one patient was angry, but I was very calm and I was trying to calm her down. So she was okay, but towards the end also she seemed very angry. But as soon as the clock, like it was 10 minutes, she smiled and said thank you. So they are all okay. They're actually very nice. They try to help us because in one case, I think they asked me that, is there anything else you would like to ask? And I thought maybe I missed out something, but we had some extra time. I think that's why they were just trying to play around. But otherwise, they are really nice, and there's nothing to worry because they are just doing their roles.
So when you
And
did the sessions with me, both Dr. Janet and Dr. Sandria, uh,
Mhm.
were the examiner nicer than me?
uh,
You were
yeah.
nicer.
Two were actually really good because Dr. Raza was also a little intimidating during the session. So he gave that feel of being angry and upset.
So that's
So
to prepare you, right? Of course.
yeah, so that was so because of that experience, they seemed a little nicer.
Okay. Don't worry, if I become the examiner, I'll be nice. All right. And I might, but the problem is the conflict of interest I have with them because of the courses. I have an offer in place, so you might find me on the other side. Okay. So the next question is, can you use a tissue to wipe the mouth mirror while doing crown prep? Yes, you can. You will have a napkin on the patient's chest, which you can use to wipe your mirror. Dr. Sandra, Dr. Janet, you can add to this.
So I didn't really wipe, so I'm not quite sure. Uh,
I cleaned my mirror by spraying it with water and then drying it. So I didn't touch anything.
Yeah, I would say that is an
I
easy
didn't
way
use
because you have the triple syringe with you. So instead of wiping it with a towel or the napkin they have, you can just blow the air and it will be fine. Try to keep the mouth mirror a bit far from the task you're doing so the water splashes don't go onto it. All right. Is there any particular order you prefer to do the technical task?
So I did it the way Dr. Raza had mentioned. That is all the preparatory first and then all the restorative second. And that actually worked out for me because I got caries removal for 3/7 and I couldn't see properly. So that took a lot of time. And I was fresh. So I cleared that task. I got a pass in that task. I could do it well because I was absolutely fresh. Even RC, I did in the beginning, first half. So that went well, even crown prep for that matter. So I went with the same order that Dr. Raza had mentioned, and it worked out well for me.
What about Dr.
For me,
Andrea?
I did mine in reverse. I was thinking that if I'm going to start the same way as everybody will be starting, like the crown preparation, for example, then the
Mhm.
station will be busy, and I'm going to consume my time just waiting for my putty and getting my these things. So what I did, I started with a restoration, the composite first, and then I did my caries and endo task in the morning, and then in the afternoon I did the rest.
Okay, yes. The thing is that basically the order does not make a difference as long as you have to make sure to complete everything in the 6 hours time you have. The advice that I gave to Dr. Jinit was to keep things simple, all right? But again, that's not one way of doing the right thing. There are many ways of doing the right thing. I have seen candidates doing preparation, restoration, and I've seen candidates doing the entire preparation in the first half of the exam, then restoration. I've seen candidates doing the restoration and then preparation. So it does not really make much of a difference, all right? One reason why I advise Dr. Janet to do the preparation first is because when you go into the exam, you are stressed because as the exam starts, the time starts, and you're given the task to do. You need to make sure that you uh, don't involve yourself in a lot of infection control activity. What I mean by that is because of the preparation task, you just need probably the burr block, right? And a few instruments, right? So your bracket table remains clear during that time. So that's the reason why I advise Dr. Janet to start with preparation, because you just have the burr block, your handpiece is already there, and you just do all the preparation tasks, because all preparation tasks basically involves the burr mostly, right? So that's one reason of keeping things simple in regards to infection control. But again, that does not mean you can't start with amalgam. You can start with composite, you can start with amalgam, whatever you feel you are comfortable with. All right, that does not make a difference. Any advice on stress management on the day of the exam? Would you add anything to this, Dr. Janet or Dr. Sandria?
Um, as such, calm yourself as much as you can. Don't look at others and pray
Yes, I
and
would
go
like
and
to
do.
add something to this. How would you say they should utilize the break that they have, especially on the technical day, the 45 minutes break?
So I sat and I just closed my eyes and I was calming myself. I didn't look around. I didn't look at anyone. I just ate and sat and relaxed. That's it. And
Yeah,
don't
that's
think about what you did in your previous task or anything. Just go and continue and make sure you finish it on time.
Yes, Dr.
yes,
Sandrick.
that's what I did as well. That's
Okay.
exactly what I did as well. Don't talk to anyone. Make sure that you do the inner work. If you have a small break, utilize that break to calm your nerves. Um, don't don't put the stress on the previous task to the next task. So leave it. The same goes for communication. If you think that you didn't do good in that station, when you open that door and leave, just leave it behind, and then you do your best at the next one.
All right. Thank you for that. So we have next question. Doctor, how Maham and Ahsan from Pakistan did your course and they get in touch with you? Well, we have the Academy's page, we have a WhatsApp number, we have our email where you can get in touch with the Academy. Yes, both of them were in Pakistan. They cleared the exam in the first attempt. Unfortunately, they are not able to attend the session that we are having now because of the time difference. They are working currently. Ahsan, I believe, is currently still in Pakistan. Maham, she has moved to Sydney on her spouse visa. So I believe she currently is in Australia or might be planning to move in the next few months. But yes, they did their entire preparation through our course while they were in Pakistan. When they came for the exam, I believe they attended a one-day technical OSCE course, and that was more than sufficient for them to clear the exam. You used amalgam carrier or tweezer to carry amalgam. So what did you do?
I use tweezer.
I use tweezer as well.
Okay, so no one is using the amalgam carrier anymore. Okay, that's good. Is it now the other thing I'll add to this is that you see what you do in the patient's mouth, which is the mannequin's mouth, is of no relevance to them. To tell you very frankly, the examiners or the nurses over there, they are not standing on your head during the technical task day. All right, they are moving around freely. They don't really see what you are doing inside the patient's mouth. Okay, and I think you will agree, Dr. Janet and Dr. Sandria.
Yes.
So you can do
Yes.
things in many ways as long as you're doing it the right way. Okay. So no one is telling you that you are doing this wrong. Many candidates in the past have told me that you can't place the TOEFL Mire on the palatal aspect. I say, why can't you? A lot of candidates have done it from our academy. They have passed the exam. They're practicing in Australia. So whatever you do in the patient's mouth is really not of a concern to them. All right. Unless you start putting your arms on the patient's face or the patient's chest and you're taking support from it, then the examiner will come and tell you not to do this, all right, or stop doing this. Or if you have tilted the mannequin's head to an angle which is not clinically acceptable, they will tell you you're doing it wrong, please adjust it. They will give you a warning, but they will not mark you down for this, please remember. Is it necessary to wear loops? Again, a personal choice. I would say it's better to use it, but I have seen candidates who have done it. We have an example from our academy itself, Dr. Omar. He never used loops, and when he used to send me tasks, I was amazed how he's doing it without loops. But Dr. Janet, Dr. Sandra can add to this.
I had loops and it made a lot of difference. So I would say it's better to have loops.
I've been using loops for a very long time and I can't live without it. Somebody asked if you need to have lights in the loops. In the clinic, I used to not have any additional light aside from the dental chair light, and I think that should be enough. But in my exam, I used my loops light.
Okay. So again, this is again a personal choice. Like I said earlier, it is recommended to have loops. It makes your life easier. It makes you see things which you might not be able to see with naked eyes, especially the caries task and the endo-access cavity task. All right. And using the light for the loops, again, it's a personal choice. You can depend on the chair light that you have. The one that they have in the ADC examination center is very bright, so you can depend on that. But if you prefer more, you can always use the loop lights you have. All right. If you ask me personally, I did use loops 3.5x, but I never used the light because the chair light that was there on the day of the exam was sufficiently bright, which was sufficient for me. But again, that does not mean that it has to be sufficient for everyone. You need to see what works for you. When to wear the dental loops? You wear the dental loops in the same PPE sequence that you follow, which is there in the portal. Prep must be for at least how many months? So, according to Dr. Janet and Dr. Sandria, they have said that they have practiced for roughly 5 to 6 months. So, that would be enough time. But please remember, that does not mean that it has to be the same for everyone. We have candidates who have practiced for more time. We have candidates who have practiced for lesser time. So, it's not a written exam where you have to go through the content and the mocks and everything. It's a candidates based exam. Some candidates will master the task soon. Some candidates will take more time. So, it's a candidate specific preparation based exam. During the technical task, you are to drop your glasses on the clean trolley. If I'm using my prescription glasses, do I need to do that? And if no, how do I do my PPE since I'm wearing my mask first before the classes? So what would you say, Dr. Janet or Dr. Sandria?
I didn't actually get the question.
If you're using your prescription glasses as your PPE part, which is your safety eyewear, now make sure that your prescription glasses has the side shields, right? Now, once your prescription glasses has the side shields, it will be considered as your part of PPE. All right, especially on the technical OSCE day. So you'll be treating your prescription glasses in the same way that you will treat another uh, safety glasses for someone who does not have prescription glasses. So yes, once you enter the room, you will be keeping it on the top of the trolley, which is the clean trolley. And then once the 3 minutes reading time is done, the 10 minutes time prep task presentation time starts, you will be following the same PPE sequence, which you'll be doing no matter whether it's a prescription glasses or normal safety eyewear. All right. How to manage if anything drops? Now, if anything drops,
Depending on,
yeah, yes,
yeah. Please continue, Dr.
it's okay.
Raza.
You can answer.
It actually depends on what kind of material you drop, because for me, one of the tissues dropped, and then I also dropped, what did I drop? Yeah, I dropped my tissue, and then I dropped one more thing I forgot. I dropped my used wedge. So you have to, they will give you instructions in the beginning, like which areas you can touch, which areas you cannot touch. If you have any doubt, you can ask them or you can raise your hand, so the examiner or some proctor will come to you, and then you will tell them that I dropped something. They will ask you, what would you do in a real clinical scenario? Then you will explain. Like for example, for my wedge, because it's sharp, the examiner asked me, what would you do in the real life scenario? Then I told her I'm going to pick it up myself because it is a sharp, and I'm going to put it in the sharps bin, and then I will do my hand hygiene again. That's it. You don't complicate things. You have to learn infection control by heart. And by heart, that means that you will do it without even thinking what to do next. And it will come to you when you practice every day.
And again, the answers to most of this question, I believe, is there in that file that we have. how to manage if you drop something, so you can just know what to do if you drop something. Candidates say light is good in the exam. Do we need loops with light or only loops can work? I have already answered that. In the root canal task, how would I know that I have 2 canal or 3 canal lower molar tooth? So did you guys have this experience, Dr. Janet or Dr. Sandria?
I got upper 6, 1 6.
Okay.
I also have the same.
Okay, now for
But
you,
what I notice is that
yeah.
from the one dental tooth, endo teeth, the distance between each orifice from the one dental teeth is very far. Meanwhile, in the exam, the distance between these orifices are quite close to each other. So you have to be very careful. I also got upper 6, and when I compared it when I was doing my practice, I it was totally different in the sense that if you are like me, I dropped according to the anatomy or the points of the orifice, then you should
Mhm.
not do that on your exam day and just follow how Dr. Raza says in the portal.
Okay. Yes, the thing is that no matter how the tooth is internally, the rubrics remain the same. So your priority should always be to know what the rubrics expects from you, right? It's not that every tooth that you practice will be the same that you will have on the day of the exam, especially with the endo task. Now, coming back to your question, whether it's a 2 canal or 3 canal, frankly speaking, you would not know before you start the task. But if you go carefully, you will be able to see whether the mesial side has 2 canals or 1. Okay. Now, we don't have Dr. Abigail with us today, who also cleared the practical exam recently with us at our academy. And I would love to have her here, but unfortunately, she's very sick. She has a sore throat, and she had the new cost communication OSCE cases as well. And she cleared the exam, and her batch was the first one where the new communication OSCEs were introduced, the 3 new cases. So she cleared them. So the thing is that it's not about if the cases are new. If you know how to manage them, dentistry is not going to change, right? They might add few case data, case information, they might change the case information, but the approach remains the same. And that's what you need to learn. That's what I always try to emphasize in any video, any content that you have in the portal with us in the Academy's courses. That is my main emphasis, that please make sure that you know the approach so that if anything new comes in the exam, you are ready for it. Okay. Please guide technical task and OSCE should be done daily together, or few months for OSCE and few months for technical task. Yes, Dr. Sandy, Dr. Janet, how would you answer that?
I think that's a personal opinion. So on days I was tired to do technicals, I made sure I did OSCEs at least. And when I'm at home the whole day, I used to divide the day and do OSCEs in the morning or technicals in the morning and vice versa. So it depends on your time management, how much time you have and where you can fit it.
Okay, Dr.
I
Sandy.
would say that in the beginning, or maybe the first 3 months of your preparation, you have to do everything. And then from there, you can gauge yourself, which is your strongest point or your weakest point. And you should be spending more time in your weakest areas so that it becomes your strong areas. And in the remaining months, you should be mastering them already. So if you're thinking that I will do this OSCE first communication in this month, don't do that. Familiarize everything and then see and gauge yourself. Where are you in those kind of tasks?
All right, thank you. How long putty takes to hard? I heard that it takes about 20 minutes. And if so, do you suggest doing other prep tasks till putty gets hard? So did you have the experience of the putty taking 20 minutes to set?
So I kept the putty to harden and I started with caries removal task.
Okay. What
For
would
me,
you
the putty sets the same way as my putty. I'm using a different brand of putty, not the same as the exam putty. But with amalgam, during the exam, I have to do my amalgam twice because I was practicing with regular set, and the amalgam in the exam sets very slow. So in my first amalgam, when I was trying to floss and remove the debris, when I flossed, the amalgam came out because I think it was not set well. And that was maybe the last 20 minutes until my exam is over. So I was panicking internally, but I have to, this is where stress management really comes in, how you will manage that.
So you are saying
But
that your
yes, I
amalgam was
think
setting slowly.
yes, my amalgam was setting slowly, so I was always checking the timer and see because we had this discussion before. Some candidates said that it sets slowly, some candidates says that it sets faster.
Mhm.
So the moment that I started the mixing, I was already timing that and see if it's the same as my timer when I was practicing the regular set. In my case, it sets very slow.
Okay, all right. Thank you for that. In Australia, technical course would be with you. No, for technical course, we usually refer candidates to Dental 101 for a one-day technical course, but we are planning to open an academy in Perth in the next few months. So let's see how it goes. But for now, no, we have a complete practical course that we run where the candidates benefit. And for technical, I usually refer them to Dental 101 because the mentors who are teaching at Dental 101 have been my candidates in the past. And I believe in the methods of what they teach because I review their course materials every 3 months to make sure whatever they're teaching to my refer candidates is in the right order. Can we just do mulling of amalgam and simply place it with our fingers? Yes, Dr. Sandria, do you think she should do that?
No,
All right.
did
Now,
you mean that you will put the amalgam using your fingers? No, this is violation of infection control.
yes. Now, technically, what I would suggest here is that you can't do this, okay, picking from the bracket table because you'll be placing the mixed amalgam capsule into the amalgam well, right? So when you move it from the amalgam well to the patient's mouth, don't use your bare fingers, right? But to make your life easier, what I would suggest instead is that use a tweezer, like they have mentioned earlier in the chat itself, that you can use a tweezer to move it to the patient's mouth. If you feel when you are close to the patient's mouth or inside the mannequin's mouth, you feel that your amalgam is not stable, then you can just, use your fingers and press it in the cavity. All right. No one is looking what you're doing inside the patient's mouth or the mannequin's mouth. What is the maximum tilt of mannequin during tasks involving maxillary? You can't tilt the mannequin more than 30 degrees. And to keep it simple, you can't tilt the mannequin more than what the patient generally clinically can accept. All right. Are we allowed to change the intensity of light, change adjustment of loops with gloves on? Do we need to follow infection control? I think they must have mentioned, Dr. Jin and Dr. Sandra, that you can use a gauze to adjust your loops. Did they?
No, in my session, they didn't mention anything.
Yes, the examiner will give you an extra gauze, so you have to ask them, like, if I want to adjust the lights from my loops, what will I use? Then they will give you an extra gauze for that, and make sure you only use that gauze to touch your loops. Whichever part of your loops, you should only be using
And
that
they
gauze.
said this during the orientation session before the exam started, right?
Yes.
Okay. What to ask if you're done with the case and some time is left? If you're done with the case, which would be very rare because usually time runs very fast, but if you're left with time and you have done everything, there is nothing to worry about. You can leave this task, the station, the room once you're done. But it will be very rare for you to complete everything because there will be always something that the examiner will keep you involved by asking questions. How much time one putty index takes to set an exam? I hope 20 minutes for 3 or 4 putty index. Well, usually you need to create three. I won't say 4 putty index. Three is enough. And each putty will roughly take around 3 to 5 minutes to set. All right, depending upon the exam environment. In summers, usually it sets faster. In winters, it sets a bit slow, but the difference is plus minus 1 minute, not a significant difference. All right. So that is about it. And how much about ProTemp? ProTemp will usually set around 5 minutes. All right. So make sure that you give sufficient time after placing the putty for the ProTemp to set. And once you remove the putty, let it for at least 2 to 3 minutes so that it sets completely. Before removing the provisional from the prepared tooth, use an alcohol swab, rub the putty over, rub the provisional crown with the alcohol swab, and then take it out from the tooth. All right. Okay. Thank you so much, Dr. Janet, Dr. Um, Sandria, for your time, for your involvement, for helping the future candidates who are planning to sit the practical exam. I wish other candidates who were who did clear the practical exam were there today, but unfortunately they are not available due to time difference. But they might be available for any questions since they are in the practical WhatsApp group. So if you have any questions, you can always ask them, and make sure that you take valuable advice from the candidates who have cleared the exam that they have given today, and make sure you keep yourself involved in the preparation. All right. Thank you so much once again, Dr. Janet and Dr.
Thank you,
Sandria.
Dr.
Wish you all
Raza.
the
Thanks,
best.
Dr.
If you
Raza.
have any questions regarding the further process, the APRA, the registration, the visa, the English exam, you're more than welcome to message me. All right.
Yes.
Thank you.
Thank you,
Have
Dr.
a good night. Take
Thank
care.
you. Thank you, Dr.
Congratulations.
Raza. Bye-bye.
Take care.